Did you know your pet has to be visible on camera for your vet to legally prescribe medication? Hi, I'm Lyndall from Vetster, and today we're discussing everything you need to know and how to prepare for your online vet appointment. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
Virtual vet care is incredibly convenient, but a few things make the difference between a really productive appointment and one where your vet is left guessing. Getting prepared before you log on means your appointment time can focus on what actually matters: evaluating your pet and coming up with a plan. Your pet must be present and visible on camera during the appointment. The veterinarian cannot do a hands-on physical examination, so what they can see through the screen is what they have to work with. Being on camera also establishes the veterinary client-patient relationship, which is required to practice veterinary medicine. Without your pet visible, the vet may be unable to provide a diagnosis or prescribe medication. If your pet is restless or hard to hold, having a second person there to help makes a big difference. Before the appointment, gather as much information as you can. You will want a timeline of when symptoms started and how they have progressed, including any recent diet changes or stays at boarding facilities. Have your pet's medication and supplement labels on hand, along with a summary of their medical history, their current weight, and their vaccination records. If you can, take their temperature and note their breathing rate and gum color. The more you bring, the more time your vet can focus on evaluating your pet rather than gathering background. Here is a tip many people do not think of. Upload photos or videos before the appointment, rather than relying entirely on live video. High-resolution images give your vet much better detail than a live stream. This is especially important for small areas like teeth, eyes, ears, and paws. Start getting ready about 30 minutes before your appointment. Find a small, quiet room with good lighting, positioning yourself so bright light or windows are not behind you. Have treats on hand to keep your pet still, and make sure your device is fully charged with a reliable internet connection. During the call, your vet may ask you to show your pet walking, their belly, between the toes, inside the mouth, under the tail, or their gum color. Virtual veterinarians can assess how urgent a problem is, offer home monitoring tips, address minor behavior concerns, recommend follow-up appointments, and in many cases diagnose and provide treatment plans. Conditions handled well through telehealth include skin and ear problems, litter box or urinary concerns, digestive issues, mobility concerns, behavioral questions, nutritional guidance, chronic condition management, palliative care, and follow-up consultations. There are situations where an online vet may not be able to prescribe. If your pet is not on camera, if the condition requires hands-on examination, if the video quality is too poor, if your pet won't cooperate, or if regulations in your region don't allow it. If your pet is showing signs of a medical emergency, do not wait for a virtual appointment. Collapse, difficulty breathing, severe bleeding, significant pain, a sudden change in condition, or ingestion of something toxic all require immediate in-person emergency care. After the appointment, you might receive home care guidance, monitoring instructions, behavior or diet recommendations, or a prescription that can be filled at a local or mail-order pharmacy. For anything requiring hands-on diagnostics or emergency treatment, you will be directed to in-person care. If you would like to book a virtual appointment for your pet, head over to vetster.com. Our vets are available around the clock, whenever you need them. Thanks for watching, and we'll see you in the next video.